Hello, soon. This is Dr. Faizan Mirza. I'll be covering some questions related to infectious diseases in this video. So this question came regarding the topic of cholera, and we know it's a major disease when the sewage line gets mingled with potable water. So the question actually starts off. This question is from Asian 2019 variant 22. So bacterium Vibrio cholera is a causative agent of infectious disease of cholera. The features of bacterial cells are listed. It is also having flagella for movement. We know that. Complete the figure by drawing a label structure found in Vibrio cholera. So this only the outline was given to you. So when only the outline is given to you, so you can expect that what was given to you and what you really need to add. So this was what was given to you all, and you can see this outline is can be considered as a cell membrane or cell wall either. So if you're taking this as a cell membrane, then you have to draw a cell wall outside. If you're taking this as a cell wall, then you have to add the cell membrane inside. So what I did, I took this. I took this as the cell membrane, and I started to draw a cell wall outside. So yes, the cell wall is present on the flagella as well. So yes, many students ask me that whether cell wall is present on the flagella or no. Oh, yes, it's present on the flagella as well. So the cell wall need to be added, loop DNA need to be added because that was a chromosome, the circular plasmid, and 70s ribosomes. These are the points that you need to add here. WHO collects data from Cold 194 from 194 countries which are member of WHA. In 2015, there were cases of 42 member countries in WHA. Total number of cases of cholera were 172,454. This is the total number of cases. The deaths resulted in 23 countries. The total number of deaths in countries were 1304. The case fatality rate of cholera is a proportion of the case of cholera that results in death within a particular period of time. So this information is given to you what case fatality rate actually means. So this is important because the question further asks you to calculate the case fatality rate. So when you know what's actually the case fatality rate, you can very well apply the formula yourself that you just have to divide the values of how many deaths have occurred out of how many cases were reported, and you multiply by 100%, you get the answer. The answer to be to nearest to the 0.1 decimal place, as already mentioned, 0.1%. So 0.81% will be the answer. Many of the 23 countries reported deaths from cholera in 2015 had a case fatality rate of less than 1%. However, two countries of the 23 had case fatality rate greater than 5%. So this to explanation of the high case fatality rate in the two countries. So yes, health facilities were not available, the living standards were low, sewage was not treated, clean water was not available for consumption, lack of medicines, poor hygiene, poor nutrition among people resulted in weakened immune response. So all these can be mentioned. In 2010, the country Haiti experienced a major earthquake. So we know that earthquake and landslides actually lead to increased chances of cholera outbreaks. This led to outbreak of cholera explained by the earthquake may lead to cholera outbreak. Water supply gets contaminated and affected due to the damage to the pipes and the sewage and the water supply. Large scale contamination can occur if the same water is used for drinking without chlorination. Infection would start to spread. Now, this data here actually shows to you how in 2008 and 2009, 2010, the cases were gradually increasing. In 2011, there was a sharp rise in the case. The number of cases got increased a lot, and the number of countries affected again increased as well. And after that, this decreased, and again this increased slightly, and then decreased further. So you can see case increase, the highest increase is there, and then there's a decrease. This is the total, you can say, increased number of countries are being affected in the year of 2011. The earthquake came in 2018 in Haiti, so you can just add the annotations in your graph to just understand what's happening. So you can see that why earthquake that came in 2018 affected the countries in the next year, because the disease spread by next year into the surrounding countries, and that's why the cases increased. And why the cases started to fall, because the treatment was available, the antibiotics were available, people were getting treated, so less infection being there in the population actually reduce the chances of where actually it just broke the transmission cycle. So the cases decreased, but then the cases increased further. So why the cases increased? Because probably an antibiotic resistance came, and this antibiotic resistance strain started to infect again, and again people got immune to it. So again they started to decrease. So this is how the fluctuation keeps occurring. But a major fluctuation comes when there's a major change in the environment condition. For example, in this case, it was the earthquake. Let's move on to the next question. This question is about tuberculosis, and after tuberculosis, the question just continues with tuberculosis. And what tuberculosis basically, they are saying that Bacillus calmette is a vaccine only available as a vaccine for protection of infectious bacterial disease tuberculosis. Many countries in the world have BCG. In Pakistan, we have been using BCG ever since 1948. And Pakistan and India were the only two countries that started using BCG outside European countries back in 1948. So TB is the most common, just a fact, and I'm recalling TB is most commonly transmitted from person to person by aerosol infection. The causative organism is present in the airborne droplets. Name the species. So the species M. tuberculosis, because they're asking from person to person. You cannot state the ambovis here because in M. tuberculosis, the main causative agent from person to person. Stages one reason why a child in a country with a low number of cases of disease would be at a high risk of developing TB. So why the mother was not exposed to the antigen initially? She had no antibodies against it, and she would not have passed those antibodies to the baby by placenta or by lactation. As a result, the baby will be more you can say susceptible to getting infected. Furthermore, you can see the incidence in 100,000 people. We always use a term of, in most cases, we use a term of the statistic of 100,000 people because it is easier to compare 100,000 people that you can see this as a value of how it is changing over the years or how is it changing across the years in one country. And for example, you can see in low economic socioeconomic group, this was the condition. In high socioeconomic group, this was the condition. So per 100,000 people, it's an easier statistic to compare. So describe the pattern shown. So you just give the general trend here. You show that the low income has the highest incidence and high income has low incidence. The generally decreasing overall till year 2016. You can see the general decrease. So yes, from 2053 did this decrease, 244 decrease, 227, 84 to 74, 14 till 12. So yes, generally every year, every income group actually reported a decrease. But yes, the more low income were getting were infected as compared to high income. So you just need to mention all these. Moving on, there's an evidence BCG vaccine is also provided protection against diseases of leprosy. Leprosy is caused by a bacterium that is closely related to TB, suggests why BCG vaccine can provide protection against leprosy. So leprosy, although it's not in your course, but such questions do come. They ask you suggest. So obviously, if the vaccine is giving indirect protection to another disease, that means that that pathogen is also having some epitopes or antigens which are similar to the ones which you have memory cells for. So the person having BCG vaccine would already have memory cells. The circulating antibodies are already there against the antibody and against the vector of Phoebe. Since leprosy causative bacteria is closely related to it, the same antibodies, variable region can still bind to its antigen and evoke immune response to provide protection. A baby gain artificial inactive immunity to TB after having BCG vaccine. The baby can also gain natural passive immunity to TB. They're asking a difference between artificial active and natural passive. So you need to recall what's artificial, what's natural. You need to recall what's active and what's passive. So you need to just compare one for the other. So we know that in active immunity, the body is exposed to antigen. That's exactly when active immunity is occurring. Memory cell will be produced. Artificial active means that you're getting yourself vaccinated with BCG. Since the person gets exposed to the TB positive antigens, the immune system gets evoked. Passive immunity, on the other hand, is when the person gets protection without getting exposed to the antigen. It's a natural passive, which means the mother is passing the mother who was previously exposed to the antigen would pass on the antibodies to the baby through placenta or through breast milk. So this question from Agent 20, Variant 23 actually deals with malaria. Since 2016, the highest number of cases of malaria and deaths were caused by a disease where sub-Saharan Africa, in many areas of sub-Saharan Africa, malaria is endemic. We know endemic means the disease is always present in a population. And people are at high risk of becoming infected with Plasmodium pathogen. In high risk, it is recommended the homes are protected with insecticide-treated nets, ITN. It means the person sleeps inside these insecticide-treated net. We know that if a person is sleeping inside this insecticide-treated net, the person would be bitten by a mosquito. The mosquito would just not go into the inside the net because when it will settle on the net, it will die. And similarly, if a patient is sleeping inside the net, the patient will also not be able to pass the disease to other because the mosquito will not become vector because when the mosquito comes and try to bite or sting that particular patient who is already having malaria, the vector insect will not become vector because the insect will die when it settles on the insecticide treated net. Because we know insecticide actually means insect killing chemical. The surface inside homes of Anopheles mosquito may rest sprayed with insecticide. This is known as indoor residual risk spray. Explain how IT and IRS can help bring transmission cycles. So yes, mosquito prevented from transmitting Plasmodium. The mosquito already carrying the pathogen cannot transmit it to the new host. People already infected will not pass on the Plasmodium to others since mosquito would not feed on their person's blood. Insecticide would kill the mosquito vector, thereby reducing the chance of the disease being transported. The Plasmodium will be transported to the new host. This will decrease. Now, data is shown to you. Whenever a question comes for infectious disease, they normally show a data, and you have to make sure that you understand what is displayed in the data before you jump onto the question that you have to address. They are saying to you the sub-Saharan African risk of malaria that is protected using IRS and ITN, both in 2010 and 2016. The years are mentioned to you. You can see the key here, and you can see people who have been using ITN only, they were about 20% in 2018, and now they are way more. So you can see there's an increase in ITN, people using ITN only. IRS only. So people who were using IRS only were this much in 2018, and by 2016 they are very low. So this trend can be seen. Apart from this, you can see there's a positive trend increasing. In for example, in 2018, only this much of proportion of population was protected, because this is given to us on y-axis, percent of population protected. So this number can be quoted from y-axis, that this much population was protected in 2018, and by 2016 almost 56% of population got prevented or protected. But still, even in 2016, after spending all these years, still how much population is at still risk? 44% of population is still at risk of getting disease. So that main trend in figure 2.1 shows that there is an increase in the percent of population protected over time. State one other trend. So the other trend could be ITN use is increasing, IRS use is decreasing. Explained by the main trend shown in figure 2.1 could be a concern for World Health Organization. So increase is not considerable or not very significant increase or change from 2018 to 2016. 34% to 50% increase, 44% still at risk. The difference of figure 2.1 suggests a reason of the for the difference in the trend shown in ITN are only compared with IRS only. So ITN is easy to use. We know you just need to sleep inside the net, so that would be much easy to apply and mount. More affordable, as less it would need less workforce and more cost effective rather than spraying the surfaces. They're saying to you the primary immune response antibodies of Plasmodium are produced within 1 or 2 weeks of following infection. In some people, the pathogen is eliminated and concentration of antibody in circulation decreases over time. Infection again by Plasmodium with the same antigen cause secondary immune response that involves antibody production. Stating explain how antibodies response following second infection would differ. So we just mentioned the role of memory cells here. So the memory cells or the B cells or the T cells are already there. Yes, T cells also have memory cells. So some students think that only B cells are memory cells. So yes, T cells are memory cells as well. These memory cells will quickly recognize the antigen of Plasmodium upon entering the second invasion. The plasma cell would form antibodies at a very fast rate. Cytokines will be released by the helper T cells. They will increase the rate of phagocytosis. Will be high. Plasmodium would be cleared off in less time. In malaria, production of antibodies beneficial to recovery, whereas in disease, this is myasthenia gravis. Since this myasthenia gravis is not there in the syllabus 2022 and the syllabus that we are following further, so I think we can end the question with this part. This question came in May June 2021. This was variant 22. Although this question deals with myasthenia gravis, so the first part of this question, it deals with autoimmune disease. We can ignore that. This is a active immunity, passive immunity, and the role of antibiotics. I think you can do this. This is tough. It's pretty easy. So I'll just move on to the data handling. So figure 6.1 is a summary of some statistics published by UNAIDS for HIV/AIDS, about HIV and AIDS for the year 2017. So figures are shown to you. Globally, 36.9 million people are living with HIV. 35.1 million adults and 1.8 million children. So this many people, if they are already suffering from HIV, there's an increased transmission to people and children. So you can just decode this information here. Furthermore, 21.7 billion people were provided ART. ART is antiretroviral therapy. So obviously it will have a considerable cost. So remaining did not receive ART treatment. So out of all this million of population, 21.7 were receiving this ART therapy. 47% people of provided with ART while still living with HIV do not have detectable levels of virus, because that's the main aim of ART. Antiretroviral therapy, when given as a treatment to AIDS patient, it reduces the number of viral particles in the body so much so that it goes undetectable. And this low viral load actually aims at better survival. Furthermore, it's mentioned 940,000 people have died from HIV. And if they are showing the arrow directly from here, it means they have not received any ART. So this shows you the effectiveness of ART is very strong. And people who were not given ART, they had higher viral load and they died. 1.8 million people became infected with HIV, so there is high transmission. So preventive measures are not adaptive well, which obviously can be seen from the rise in the disease. So other statistic published in this is only 75% was of the estimated 36.9 million people living with HIV knew that they had been infected with virus. With reference to information 6 point, discuss the importance of this statistic. What is the importance of this statistic? People lack awareness. People lack awareness. They are they have they are countries with a higher load for the virus to be infected, and when they are not receiving the ART treatment, or when the viral load is very high, when they have a high transmission of the disease from people to people, because the preventive measures are not adapted well. So this statistic is actually important in realizing the importance of the awareness that need to be given insight into. That's it from my side. Thank you so much.